I welcome you to visit our Meridian tooth chart. Very powerful with understanding and starting to learn links with teeth and the body. I mean, I had a gentleman that came in after 2 years. He was nurturing this big toe problem and creams and salves and all kinds of things to try to heal up this toenail. First visit to the office, looking at what his history has been, the frustration he has had with that. Yes, it is linked with the 6-year molar. So of course I venture to the 6-year molar, and there is a filling that has been in there for 30 years. It is failing, leaking. Decided to do something conservative. I encouraged him to, let's take this filling out and let's take a look at what's going on underneath there. Many times a nerve can die slowly, no pain, no toothache, no reason for it to go and die except for the original filling being very large and invasive. So as we took this filling out, we ventured in there, and it was obviously nerve had died in that tooth. And the drainage route for that tooth, right through the outside, inside shoulder, inside knee, right out the big toe. So we ventured, we finished that tooth up, did what you had options again. Everyone has a different value. Some would like to have that root canal where they take the dent tissues out of the tooth. Others would like the tooth removed. This particular case, we removed the tissues from the tooth. He finished up the root canal, and within 2 weeks, his toe was beautiful. And once again, as everyone states, it's a miracle. It really is the unknown link to the whole body health. Why do doctors talk about heart disease? Go see your dentist. We start working in the mouth. #1 place for bacteria. Of course, it will circulate through our lymphatic and our bloodstream, and anything that's a weak spot in this body will be affected. So it's a powerful link, and I think it's time for everyone to really understand it better. The chart is phenomenal. The chart will show you every part of the body that links with any different parts of the teeth. Reproductive organs, people that are having problems with any of those issues, front teeth. Many times you'll find a root canal, and that root canal, it always does have a little bit of a leaking bacteria. Our immune systems are wonderful. Many people have such an immune system, it will never affect them their entire life. Others, as myself, might have a weaker immune system, which I have to be very careful for every little chronic infection that might be in my body, that it might push me over the edge, and it might not be right for me to keep that root canal. Personally, those 2 teeth I originally talked about ended up going into root canals, and yes, I did have to lose them. I could never get healed from them, and it caused a great infection in my jawbone, which, if you look up the word cavitation, there's many studies on cavitations and dead spots in our bones. #1 place is literally the hips. The 2nd place is the jaw. And it can be very devastating and very much chronic tooth pain that's very difficult to discover. It's incredible, the power of the body. But the key is keeping the body healthy. Periodontal disease can be handled by looking at the whole body again. Once again, it's all about what's happening in here and bacteria. When this changes, I can almost guarantee you that something here has changed. So you can't go after periodontal disease. Are you one of them that's been chasing periodontal disease your whole life and cannot understand why it cannot get under control? It has a lot to do with the bacteria in our body and the lining throughout the digestive tract that could be irritated by our diet. Low-grade allergies to food. I mean, nowadays, how many people are now doing gluten-free diets and they can't have any dairy and all of these things. So there's a lot to know about diet and what's happening in here. If you truly want the epitome of true health, I believe there's answers. My journey keeps proving it to me again and again. And the power of the mind. Once again, neuroemotional technique will correct this. The rest just follows. And yes, the American world, there's probably a little discipline that we might throw into that basket. But for the most part, a lot more simple than sitting in bed not feeling good. I welcome you again to ask some questions. Do you have a diagnosis you don't believe in? Do you have a diagnosis you would like to get rid of? Diabetes, another troubling one. So many things with the pancreas. Working with emotions with the pancreas to get it fully functioning again can really change the status. And cleaning the pancreas, it gets worked. Gets overused, days and years of childhood sugars, overdoses and things like that. Special herbs, different things that you can do to do a full body flush, re-cleanse a pancreas. And a lot of testimonials and success cases where they are no longer diabetic. And yeah, it can be true, but once again, discipline needs to be involved. The first thing to do if you have any of these concerns or can't find an answer, that's the forte of this office, is we like having a diagnosis only where's the source, not how to fix our symptoms. Just call the office, 734-369-9300, and make an appointment with me for 1 hour, and we'll bring everything with you, all your supplements, all your questions, anything you can write down, and we will take 60 minutes of undivided attention, and we will come up with some short form of plan. And I think you'll be very happy with how simple, after this journey of what you've been through, how simple it can be to maybe rid this diagnosis forever.